Elsevier provides over 25% of the world's clinical content and serves over 20 million healthcare professionals. Our web and digital-based clinical solutions take our trusted content and integrate it into the clinical workflow, helping healthcare professionals make better decisions and ensuring patients receive better care at every stage of the patient journey. So let's see this in action. Jane Smith is 45 and a mum of 3. She's been feeling under the weather for the past 4 weeks. Jane logs on to the online digital health and symptom checker and completes a short assessment. Here, Elsevier's Arezzo technology analyses her symptoms in light of her age and past history as a smoker and offers Jane self-care advice. However, when Jane's symptoms get worse, she knows to call a national health helpline. The triage nurse Jane speaks to is supported by the same clinical decision support tool, and after further assessment, the nurse makes an online appointment with Jane's GP, updating Jane's medical record with her worsening symptoms. When Jane visits her GP, it is Arezzo Pathways integrated with her medical record that supports the GP's decision-making. Jane's GP requests that she receives an urgent chest X-ray and be referred into the local respiratory outpatient clinic. He uses Arezzo Pathways to send the referral letter with supporting information whilst providing Jane with education handouts. Jane is seen in an outpatient's clinic 6 days later, where her doctor accesses the hospital record, the referral document and chest X-ray result. The radiologist has already used StatDX from Elsevier to support his review of the image, matching images and radiology information from its extensive library. The clinic doctor, following examination and reviewing a wealth of content in Clinical Key, selects his differential diagnosis in the EHR. The differential diagnosis is linked to an order set created from the Elsevier catalogue. This includes radiology, labs, investigations and initial treatments supporting his diagnosis and initiating care. The doctor is confident that the order set is based on best practice and standardised protocols, offering the best care for the patient. The clinic nurse then initiates the relevant Elsevier care plans for Jane based on latest evidence for oncology care. The care plan ensures an interdisciplinary and evidence-based approach to care, supporting Jane and her family through a difficult time. Jane is admitted to hospital for a bronchoscopy and the start of her treatment. Alongside this, the junior doctor in the clinic is asked to present Jane's case to his colleagues and to establish current and new thinking on the treatment of patients with lung cancer. The doctor uses the info button on Jane's clinical record to search Clinical Key so he can present and share the latest evidence. Jane's record has been updated on the GP system with a diagnosis of lung cancer and with information about her drugs and treatments started in the hospital. She has commenced her treatment and has been discharged home with information and support from the Elsevier patient engagement solutions delivered in an interactive and patient-friendly way. This allows Jane to be an active participant in her care at home, where a large amount of her care will take place. So, Elsevier Clinical Solutions have helped Jane and many others receive early diagnosis and the most appropriate treatment. Our solutions provide the right care at the right time, putting the patient's needs at the core, whilst supporting healthcare providers in provision of consistent, high-quality, cost-effective care across traditional care boundaries.